Hello everyone, today we will discuss about non-competitive inhibition of enzymes. This non-competitive inhibition of enzymes occurs when the substances that do not resembling the geometry of the substrate and do not exhibit mutual competition. So as the name indicates, there will not be a competition between the substrate and the inhibitor. So the sites of attachment of the substrate and inhibitor are different. Inhibitor binds reversibly with the site on an enzyme other than the active site. So inhibitor binds here. This is the active site of the enzyme. This is inhibitor site. So the inhibitor may combine with both free enzyme and the enzyme substrate complex. This probably brings about the changes in 3D structure of the enzyme, inactivating it catalytically. In a non-competitive inhibition, Vmax is lowered. Vmax lowered. And Km will be kept constant. Km is kept constant. This non-competitive inhibition is of two types, reversible and irreversible. Reversible and irreversible. If the inhibitor can be removed from the inhibitor site without affecting the activity of the enzyme, it is called reversible non-competitive inhibition. That means if the inhibitor can be removed from the binding site without affecting the activity of the enzyme. So the activity of the enzyme will not be changed. It is called reversible non-competitive inhibition. And if the inhibitor can be removed only at the loss of enzyme activity, here loss of enzyme activity, it is called irreversible non-competitive inhibition. Loss of enzyme activity in the case of irreversible inhibition. Then the kinetic properties in both cases are the same. Next we will see difference between competitive and non-competitive inhibition. Competitive and non-competitive. No, competitive means it will be reversible, and non-competitive it is of two types, reversible or irreversible. Second difference is inhibitor, and in the competitive inhibition the inhibitor and substrate resemble each other in the structure. Inhibitor and substrate resembles each other. In the case of non-competitive inhibition, the inhibitor and substrate does not resemble. Does not resemble. The third one, inhibitor binds in the active site. In the active site. But in the case of non-competitive inhibition, inhibitor does not bind the active site. Does not bind the active site. In this case, inhibitor binds to a site other than the active site. Next one is Vmax is same. Vmax is same in competitive inhibition. Then in non-competitive inhibition, Vmax lowered. Vmax lowered. Next one, Km is increased. Then in non-competitive, Km unaltered or kept constant. Next one is inhibitor cannot bind the enzyme substrate complex. Cannot bind the enzyme substrate complex because the inhibitor can only bind to the enzyme. But in the case of non-competitive, the inhibitor can bind with both the enzyme and enzyme substrate complex. Next one is lowers the substrate affinity to enzyme. Then in non-competitive, does not change substrate affinity for enzyme. Here the complex formed is enzyme inhibitor. Here it is enzyme inhibitor or enzyme substrate inhibitor, because the inhibitor can bind to both enzyme and enzyme substrate. So enzyme inhibitor and enzyme substrate inhibitor are formed. Then here in competitive inhibition, Macalister-Menten equation changed to competitive inhibition, Macalister-Menten equation changed to V is equal to Vmax into S by Km into 1 plus I by Ki plus S plus S. In non-competitive inhibition, V is equal to Vmax into S by Km into 1 plus I by Ki plus into Km plus S into Km plus S. Here, this is Macalister-Menten equation in both cases. Then next one is Lineweaver-Burke plot. Lineweaver-Burke plot in competitive inhibition is 1 by V equals Km by Vmax into 1 plus I by Ki, 1 plus I by 1 plus I by Ki into 1 by S plus 1 by Vmax. In non-competitive inhibition, 1 by V equals, this is Lineweaver-Burke plot, 1 by V equals Km by Vmax into 1 plus I by Ki into 1 by S plus 1 by Vmax plus 1 plus I by Ki. So this is Lineweaver-Burke plot in both cases. Then next is Iodoacetate plot. Iodoacetate plot, no change in, here in competitive inhibition, no change in y-intercept, no change in y-intercept means Vmax. Next, possess steeper slope in competitive inhibition in Iodoacetate plot and smaller x-intercept. In the case of non-competitive inhibition, the Iodoacetate plot is changed to no change in slope, then that is minus Km, then y-intercept is lowered and x-intercept declines in value. That is the main differences between competitive and non-competitive inhibition. Next, we will see examples of non-competitive irreversible inhibitors. Non-competitive irreversible inhibitors. First one is iodoacetate. This is an irreversible inhibitor of the enzyme like glyceraldehyde 3-phosphate dehydrogenase. Glyceraldehyde 3-phosphate dehydrogenase and papain. So this is an irreversible inhibitor of enzymes like glyceraldehyde 3-phosphate dehydrogenase and papain. Papain is a proteolytic enzyme extracted from raw papaya. Then this iodoacetate combines with SH group. It can combine with SH group then at the active site of the enzyme, SH group of enzyme, and thus inactivating the enzyme. That is iodoacetate. Second one is heavy metal ions. Heavy metal ions like silver and mercury. They also act as irreversible non-competitive inhibitors. Next one is fluoride. Fluoride inhibits the enzyme enolase by removing Mg++ and Mn++ and stops glycolysis. Stop glycolysis. So fluoride inhibits the enzyme enolase by removing Mg++ and Mn++ and stops glycolysis. Next one is BAL, BAL, that is British anti-Lewesite. This is also called as dimercaprol. Dimercaprol. It is used as antidote for heavy metal poisoning. Antidote for heavy metal poisoning. So the heavy metals act as enzyme poisons by reacting with SH groups. This BAL, that is British anti-Lewesite, has several SH groups with which the heavy metal ions react and thus removing their poisonous effect. Next one is Disulfiram. Otherwise called as, it is an antabuse. It is used in the treatment of alcoholism. This drug irreversibly inhibits the enzyme aldehyde dehydrogenase. Aldehyde dehydrogenase. It irreversibly inhibits the enzyme aldehyde dehydrogenase, preventing further oxidation of acetaldehyde. And this acetaldehyde accumulates and produces sickening effects and leading to aversion to alcohol. That is disulfiram. Next one is diisopropyl fluorophosphate. Diisopropyl fluorophosphate. It inhibits enzymes with the serine in their active site. For example, acetylcholine esterase. Acetylcholine esterase. So this diisopropyl fluorophosphate inhibits enzymes with the serine in their active site. For example, acetylcholine esterase. These are the examples of irreversible non-competitive inhibitors. Next we will see suicide inhibition. Suicide inhibition. This suicide inhibition is a special type of irreversible non-competitive inhibition. It is also irreversible non-competitive inhibition. Then in this type of inhibition, substrate analog is converted to a more effective inhibitor with the help of enzyme to be inhibitor. So the substrate analog is converted to more effective inhibitor. The new inhibitor thus formed binds irreversibly with the enzyme. For example, allopurinol. Allopurinol is also a competitive inhibitor. Then allopurinol, this is the best example for suicide inhibition. The drug is used in the treatment of gout. It inhibits the enzyme xanthine oxidase and decreasing uric acid formation. We know that from hypoxanthine, uric acid is formed by the enzyme xanthine oxidase. So this allopurinol inhibits the enzyme xanthine oxidase and decreasing uric acid formation. But this allopurinol gets oxidized by the enzyme. This allopurinol gets oxidized by the enzyme xanthine oxidase and this is converted to form alloxanthine. And this alloxanthine is a more potent, effective and stronger inhibitor of this xanthine oxidase and thus potentiating the action of allopurinol. That is allopurinol. Next one is aspirin. Aspirin. This is the most commonly used drug for relieving pain. This anti-inflammatory action of aspirin is also based on the suicide inhibition. Aspirin acetylates a serine residue in the active center of cyclooxygenase. So this aspirin acetylates a serine residue in the active center of cyclooxygenase and thus inhibiting prostaglandin synthesis and the inflammation. That is about aspirin. Next one is 5-fluorouracil. 5-fluorouracil. It is used in cancer therapy. In cancer therapy, this 5-fluorouracil is converted to fluorodeoxyuridylate. FDUMP, fluorodeoxyuridylate by the enzymes of the salvage pathway. This fluorodeoxyuridylate inhibits the enzyme thymidylate synthase. Thymidylate synthase. So first 5-fluorouracil is converted to fluorodeoxyuridylate by the enzymes of the salvage pathway. This FDUMP then inhibits the enzyme thymidylate synthase, thus inhibiting nucleotide synthesis. These are the examples of suicide inhibition. So this is about non-competitive inhibition. This is today's topic. Thank you for watching.